Hi, I'm Robert Cassiano, Healthcare Project Consultant for Liberty Group.
Hi, my name is John Sanati, President at Liberty Group Construction.
Today we're going to talk about the increased demand for telemedicine and how the demand for patient safety staff has really changed this year. So John, given that many offices, medical officers are having to adapt, the flow of the office, patient safety is very top of mind just because of all of the current environment that we're in. What is it that you're seeing, that you're noticing an uplift in when it comes to construction?
The healthcare industry is changing so rapidly, and lately this COVID-19 made these scientists and all these architects and MEP engineering change the industry rapidly. What happened? Right now, the people's so conscious about this COVID-19, how they want to go to the doctor's office and sit there, and the environment is not good for them at all.
Yeah.
Now, lately they are talking about, how it's going to happen at the negative pressure and positive pressure of the air flowing at the area because of the COVID. So actually this became positive for the future of the healthcare industry.
Sure.
The telemedicine is now so advanced technology. The doctors sit in his office and clients call or email, and they do the Zoom talk and get the symptom. The file is there. Right away they see the file, and if there's a precondition, right away they send a prescription. And so made it so easy. Just look at it. Instead of 20 patients going sit there at office and waiting so long, and they have a certain time, right away doctors call to the patient and prescribe what they need, and they have quality time, quiet time, and also the result is unbelievable. It's right now what we are doing with the architect, designing the quiet room for every doctor, so they have a perfectly quiet
private
room.
space.
Yes.
Yeah. So having these quiet rooms in the healthcare practice offices are very important, especially these days. And no, it's great that you're taking on that. With Liberty Group, helping these doctors facilitate these rooms because they are extremely important. And not only that, but it all goes back to the patient, safety for the patient.
Yes, Robert, and I do remember we are one of these initiative companies started working on the negative pressure and positive pressure. In MEP. What happened in the flow of the air when you are at the reception area, most of the air flow there, which is not a health for clients at all. Or you are at the operatory room, it's a small exam room, and if the air captured there is not going to be good for you to inhale that air. So that's why we called negative pressure and positive pressure. You have to pull the air out. And honestly, hasn't been easy at all. It's very costly, and also the design we are doing for the office, it has to be the square footage of how large is that, so we can pull the air and let it go out. Exactly. So telemedicine here has come so successful. Why? You are at home, you call your doctors come on the Zoom, you can see him, you can talk, they can see you, and so they can prescribe your medicine.
No, that's great. That's great that Liberty is coming up with solutions for these doctors. Well, we appreciate your time today, and be sure to look us up. Thank you very much.
Thank you very much.